Prescription medications have become the third leading cause of death in America in 2025. I'm Dr. Mikhail Kogan, Associate Professor of Geriatrics at George Washington University and physician who created the concept of integrative geriatrics as an alternative to the overprescription and the pharmaceutical-driven healthcare system. The system that confuses treating symptoms with keeping people healthy. Consider these numbers. 90% of Americans over age of 65 take at least one medication, and almost 10% take 10 or more simultaneously. Imagine the complexity. Physicians using computer systems to make sure that interactions are checked and that the medications managed appropriately. But then they're expecting patients to manage all this, to navigate this complexity in a 15-minute visit. The idea, this sort of the image, the nostalgic image of the physician in a small village or in a small town who intimately knew you for a long time, knew everything about you, and was managing your care is gone. Instead, we're in a healthcare system that most patients with complex illnesses have sometimes 10 or even more providers. Communication often doesn't work very well. Complexity is overwhelming. Errors are left and right. And that creates not just medication being the third leading cause of death, but it's basically that we're pharmacologically managing most of our healthcare. And we must stop that. We must find a way that's better. We must reduce our over-reliance on pharmaceuticals because drugs will never optimize our health. Solution exists. It combines automated systems and AI-driven solutions in combination with integrative approaches. But it needs to start with us. We need to take responsibility for our health. We have to make sure that we are aware very clearly about every pill we take. We need to start asking ourselves the key questions. Do I have to take this pill first? Do I have some alternatives? And if I don't, and I have to take this pill, is there an endpoint to taking this? Consider antacids that are taken by millions. Most of the patients don't need to take them. And when you're talking about millions of people taking a particular drug, the cumulative effect of toxicity is profound. Address minor symptoms without pills. It's possible. Often, you don't even have to take them for something that will resolve, like a common cold. Use lifestyle interventions whenever possible. The traditional safety net is gone. We must take responsibility in our hands. This isn't about rejecting medications that we need, but using them thoughtfully. It's a choice, and it starts with you. Thank you.